welcome to the 8th annual Village Healthworks December Luncheon, once again reimagined as a virtual celebration. I'm Sharon Jacob, proud board member and supporter of Village Healthworks, a purpose-driven organization that's providing quality, compassionate healthcare, education, nutrition, and agricultural programs, economic development, and community engagement in Burundi, Africa, one of the hungriest, poorest, and most marginalized countries on this planet. Thank you all for your continued support and sharing in this celebration with us again this year. The difficulties and disruption of last year continue to affect family and friends all across the globe. Despite the challenging circumstances, Village Healthworks, doctors, nurses, teachers, community healthcare workers, cooperative members, and even our construction workers all have continued to persevere with dedication and commitment to their work. We all look forward to the long-awaited completion of the Kagutu Hospital and Women's Health Pavilion. This impressive 150-bed hospital will provide life-saving surgical capabilities, along with obstetric, gynecological, and pediatric care to the people in the surrounding region, while simultaneously laying the groundwork for an improved healthcare system for decades to come. With your help, we can cultivate healing, hope, and opportunities for transformation, plus serve as a model for others to do the same. It's inspiring to see what's possible when people come together to confront common challenges. So please enjoy this presentation. We appreciate your compassion and support. Thank you for your help in changing the future of those most in need.
Village Healthworks is a social justice organization, and it's truly a community organization. We started with health, but in the process of seeing patients, we integrated education, food security program, community engagement, and music and the arts. In a country like Burundi that is emerging from this distraction war, every single thing you do is a priority.
Prior to actually going to Burundi and seeing the Village Healthworks campus, I think I would describe the organization as a small nonprofit that works in a remote part of the world, probably a country that you've never heard of. Now that I've been there, I saw firsthand that the hope that the organization and the campus brings to the community and frankly to the country is remarkable.
I look at Village Healthworks as something that we should all aspire to doing and creating on a global basis.
It's the greatest story of focused hope that I have ever seen.
Our holistic approach at Village Healthworks came as a result of seeing the needs in the country. We started with the health because we knew that people were dying from stupid death, dying from totally preventable diseases, malnutrition, starvation. And yet we're a country where you can grow anything you want. People should not be dying from injuries. No mother should be dying in childbirth because she has no access to C-section, which we take for granted. We start from scratch, building the clinic. We have 200 consultations every day. We're open 24/7, a 50-bed inpatient ward, and we have saved so many lives.
We can treat malaria cases here in this clinic. We can do antenatal care for the patients. And then if, for example, we are not able to do the surgical intervention for the pregnant woman, then we can transfer them in a proper time.
We are conducting also some clinical activities in the community, monitoring the evaluation, see how many children are sick, so that they can be enrolled in our nutrition program and can be followed in the community
At Village Healthworks, our goal is to make sure that we build a healthcare system, treating people in a dignified environment, improving the quality of life, saving lives, and also educating future leaders in the country. We started with pre-K.
The education that I witnessed in the preschool was great. We would go there every morning. The band would show up and play music. The kids would come in, often having walked for miles and miles, and sing and dance for at least an hour. That's how school starts. To me, that was a model of what early education should be.
The Village Healthworks feeding program is helping fight against malnutrition. It is also helping students to improve their attendance and performance at school to increase the success rate.
We started a boarding school, the Kibuti International Academy, recruiting children from all over the country and really creating a space where these children can ask questions without being afraid of corporal punishment. Today we have 63 students, and we don't want to tell them this is what we want you to become. We are opening opportunities for you. Do you want to become a doctor? Great. Do you want to become a nurse? Great. Do you want to become an artist? Fantastic. But most importantly, we want them to think about the problems that have affected their communities in their country, in the continent.
I want to become an entrepreneur. I know it's something very hard, but KIA is really helping me with that. I know I have to work hard. I know I have to have a vision. I know I have to have an idea that I have to work towards daily, and that's what I do right now. I want to create my own business. I want to create something that will not only help me, but also Burundi and other countries in Africa.
We can incorporate a lot of the different lessons that we have with the different departments at Village Healthworks. It is an environment where our students can actually learn by doing instead of just being lectured at in front of, by a teacher.
There's no such a thing as progress if we don't put the right education in the minds of our children, who are the hope, who are the future.
When we went to Village Healthworks, we went to see a school that had been built, and we asked who built the school, and we were told that the community members had built the school.
This is your school, and your children's school, our future.
I think that's also part of Dale's vision, is giving the community members agency and getting them to be personally invested in this project.
When I first heard about Village Healthworks, I was compelled because of the community story, the community aspect of former enemies coming together, giving their land, and paving a positive step forward from the ruins of what had been the Civil War.
If you really do not work with the local community people, you are really not going to get anywhere. Create a team, build a team, get them involved, because after all, what we do is for the community members we talk about. If we don't get them involved, then we're talking about ourselves, not about them. The goal with the Economic Development Program is to make sure that we teach livelihood skills in the community. For example, the sewing co-op, this group that is really making beautiful bags. We're talking about carpentry, teaching them skills so that they can actually make furniture and sell and have some kind of income so that their families can be able to have a life. So our goal really is to show them the how.
Here we are working with these trainees, working like full technicians. They're getting experience. This is one type of as a school.
Last time I went was Deo starting the fish cooperative. And it was fascinating to go and watch as they took the nets over this half a square mile pond, pulled all the fish out, put them into the buckets, allocated them to folks for food, allocated them into the bucket that's gonna go to the market. And you could see like entrepreneurial capitalism and the beginnings of like economic progress right there in front of your eyes. Like it was amazing.
We started the food security program. We really started with the idea of fighting malnutrition, eradicating famine. We started this demonstration garden with the veggies, with the carrots, with the fruits and all kind of stuff, and we fed them. Community members really started seeing exactly the importance of food as medicine. Knowledge of the farmers has actually been lost because of the war that lasted over a decade. And we're bringing these skills and techniques to grow food, but also knowing what is a healthy food to grow and how do you even cook it.
Muri village bamaze kwiga ngene twotera ku mirongo tugasha amatuta akitse atarabandanya arangurura acha yonona urusi isiga sisiburuka.
If you give them a little time of health knowledge, you are really going, as they say, you are going to feed them for a lifetime. Kigutu Hospital, the Women's Health Pavilion we are finishing, is going to be the center of excellence in teaching and providing quality health care. It's really going to make a beautiful contribution in improving the healthcare system in Burundi.
This hospital is 150 beds hospital with 7 delivery rooms, which are fantastic.
The challenges of taking this kind of project in rural Burundi are actually convincing many people that it's possible. And yet, the people who are suffering the most are in rural areas.
For me, one of the really unique aspects of Village Healthworks is that instead of saying, let's build this in the city and be close to where all of the doctors are, they're taking like the hard road, the road less traveled, putting a hospital in a rural area, and then really trying to engage the people who are in the community. And in doing so, they're trying to create something that can be replicated all over the world. And this is exactly what the world needs.
The construction is approximately 70% complete. We have started off finishing off the building itself with the MEP, mechanical, electrical and plumbing. The anticipated opening is still scheduled for June next year. We've had a few challenges in getting materials procured, but it's due to the logistics getting it into the country. But everybody has jumped on board to try and assist in getting these last bit of items sorted out.
Today, this new hospital is standing, it's visible, the access road is there. We are even talking about landscaping, where we plant flowers, where we park the ambulances and all that. Once we finish the construction of this hospital, people will see exactly how important that is.
The Human Health Pavilion Hospital will not only serve people of the region in Burundi, but also people coming abroad like Tanzania and Congo.
When we decrease the number of senseless deaths, when people are not traveling to places far away, leaving their homes, selling everything they have to pay for medical care, they will see the opportunity of having a hospital exactly where it's needed the most.
I'm excited to introduce to you Dr. Cherisa Gibson, Village Healthworks Director of Clinical Quality and Training. We are beyond thrilled that she's joined our team and will play an instrumental role in helping Village Healthworks prepare for the opening of the Kigutu Hospital and Women's Health Pavilion. After you've learned more about her rich background, she will be joined by my friends Ali Wentworth and Deo Gracias Nizonkiza in a conversation about their efforts to create a more equitable world through dignified healthcare.
My name is Dr. Cherisa Gibson. I'm a family physician. My work has really been focused on working in underserved populations. My professional journey has been a little bit of a zigzag. I started off as a phlebotomist in a hospital, ended up going to nursing school. And then after I finished nursing school and started working, I was like, I think I could do just as good of a job, if not better, than most of the physicians that I see. So I decided to apply to medical school. I think what I love most about being a doctor is how much people entrust me with their stories of their life and how I can be impactful in the way they think about disease, the way they think about health, about what their possibilities are as human beings. What draws me to work with underserved populations is just the incredible need. For me, everyone should have the same opportunity. They should have the same opportunity to thrive, to grow. They should have the same health opportunities. And so I feel like my work is to equalize that. I started learning about Village Healthworks actually this year. So much of what Deo is saying is exactly the things that I've been saying all of these years. So I really felt like even before I met him that we had a great connection. My role at Village Healthworks is the Director of Clinical Quality and Training. And so what that means is that in all aspects of the clinical work, how do we bring quality? How do we bring norms and standards to the work that we do? Because as we move from a health center level to a district hospital or referral hospital, there's a different set of skills. And so my job is really to ensure that all of the people who work for us in the clinical areas are able to meet that new standard. It's like my perfect job.
So you've just seen how the amazing Cherisa Gibson has come to the Village Healthworks, and we're so lucky to have her. And she is now joined with Deo, and they are going to be talking about the Village Healthworks and its impact on the world. First, I want to start with a sense of why we are here and how you know each other. You met Deo how?
So I met Deo through Ziwe Taba, who used to be one of the medical students that I worked with at Oregon Health Sciences University. So Ziwe connected me to Deo and said, the two of you really need to talk. And I think the first time we talked on the phone, we had 45 minutes or something, and it was like 2.5 hours later, and we were still talking, and we wanted to continue to have a conversation. So it was pretty special.
On a dating app, that would be called a success story.
It was a success story.
Yeah. And there takes a certain kind of person to want to go into what is an incredibly difficult situation to help people. It's much easier for both of you to take your medical degrees and set up shop in an affluent city. What is that little piece about you as a human being? Why not just stay in Portland?
It would be boring. As a family physician, we often talk about how we take care of people from the cradle to the grave, and so that totality of the human experience. Part of the appeal, I think, of Village Healthworks is, this comprehensive process of we're going to talk about nutrition, we're going to do something about education, we're going to do something about health. I mean, these are all of these, determinants of health that are all being addressed at one time. And I think that's really, for me, the attraction and the power of Village Healthworks.
I want to pivot now and talk about COVID a little bit, because I'm curious as to know how COVID affected the Village Healthworks community, what was done about it, was it contained?
We have no vaccines yet, and that has been extremely demoralizing for us. So what we really did from last year, setting up tents and around on the campus, telling people social distancing and do this and that. But it's really very hard when you are telling people what to do when they do not have the means, the resources that are available to us. It sometimes really feels like adding insult to injury. Yeah. But we did everything we could, and we're still trying to do everything we can. But as you know, the only thing really that can contain this virus, vaccine, hardly anyone in Burundi is vaccinated.
Right. Yeah. Where I, as just an observer, having gone to Kigutu for for the first time, where I really saw the impact of COVID was much more around the supply chain issues. You know, how do we get medicines in? How do we get, you know, gasoline? So it's that impact on that infrastructure, whereas in comparison to here, where, you know, things have slowed down, but they were much more dramatic in Burundi.
Because they were already non-existent. I mean, you had one ambulance. I mean, already the supply chain was worse than it is now during COVID in our country.
Absolutely,
So I want to talk about the Women's Health Pavilion. 1 in 33 women die with pregnancy or birthing complications in Burundi. What's the Women's Health Pavilion going to provide?
So the Women's Health Pavilion is going to provide what it takes to change those stats. And what changes those stats is access to emergency obstetrical care. And so that means that when women have complications in pregnancy, that they have skilled people who are able to manage those problems. They have access to an operating room, they have oxygen, they have blood, they have the things that their babies have, what they need to be resuscitated appropriately. That's what really changes the numbers for a skilled attendance at birth.
Which brings me to the education portion of the Village Healthworks, because you need these people to come in and teach and care for these expected mothers. You need educators to come in and help, like you said, be the scaffolding for the Village Healthworks. And so talk to me about that, and also talk to me about how you are actually home growing your own medical professionals as well.
So education is so key, and the reason why we're building this hospital the way we've been talking about is precisely to show healthcare professionals, the nurses, the doctors who are trained in Burundi, who never had a chance to go outside, to actually see what a dignified healthcare is. To see that it's really humanizing medicine.
And the other piece that I would add to that is that idea of creating a model. Once you learn enough, you want to teach more, and that's the model that we're creating. So we can build a hospital, and the hospital is a wonderful extension of what Village Healthworks already does. But for me, as a physician and as a teacher of medicine, the bigger build is really in this human capacity to deliver outstanding, high-level, compassionate, dignified care.
So you're both in your late 90s. You're playing Mahjong in Miami. What is the dream? What would you, at 90 years old, you look back, what's happening at the Village Healthworks, and how are the ripple effects?
I hope I can see Village Healthworks being, in a good way, more contagious than COVID and spreading all over.
So there's Village Healthworks all over the world.
And not just Village Healthworks doing that, but people inspired to actually replicate the model.
Yes.
And do that through education and training.
What about you, Theresa?
Yeah, I mean, I see. I'm sitting there with Dale in that dream there, and I'm looking, because I'm a scientist too. I'm also looking at, well, so where is my maternal mortality rate? The legacy would be, that we decreased it by 80-90%. That emergency obstetrical care was available to every woman in Burundi, every woman in the Eastern Congo, every woman in Malawi, and I mean all over the world. Yeah. To see a world, that was like that, and to feel that I had a small part in that, I'd be doing more than just playing mahjong. I might be.
Well, you've lost it a little. So.
Probably.
Yeah. By the way, I'm making you sandwiches and snacks in the back. But you're very inspirational people, and I think you'll get it done. I think your dreams will be actualized.
Now I'd like to introduce you to my friend Bill Bullard, an amazing photographer and educator who has traveled 3 times to Burundi. Bill has provided his talent not only as a photographer, but as an educator teaching a photography course to 10 students on the ground in Kigutu.
Like many people, I got introduced to Village Healthworks through Bill and Sharon. I knew nothing. I knew nothing about Burundi. I knew nothing about Deo. I had just retired after 40 years of working in schools, and I was very eager to find projects for my lifelong interest in photojournalism, or something that might be useful. What I had anticipated from our meeting is that the photography would be great, which it was, but what I didn't anticipate was the connection I would feel almost immediately to people, to the place, to Deo's vision, to the kids particularly, and it fueled this much deeper interest in the place than I had anticipated. The image that I have made many times that says the most to me about the place and the people are portraits of the women, the mothers mostly, in the clinic with their kids. And these are women who have walked for hours and hours and miles over dusty dirt roads, usually with a sick child or two and with the rest of their kids in tow. And they arrive early in the morning so that they can be there on time for the clinic. And they always arrive impeccably dressed. And I always took this as a sign of their respect for the place, for their doctors and for the caregivers and for the campus, that place is really a place of safety for them. I think what has inspired me most in my work there is this synergy between the hospital, which is literally saving the lives, or will save the lives of these women, and the schools, which will save the futures of these children. These schools are so important because the leadership of this country is going to come from these kids. For me, the importance of telling this story is to shine a light on this country and to shine a light on these people, particularly for Americans who have no idea that Burundi exists. To be able to show why these people deserve what we're doing for them is really critical, because once you feel that, the resources that they need to build this hospital and build this school and lift themselves up, I think will be there. So for me, it's an exercise in persuasion. That's what I'm trying to do. Persuade people that this is a really vital thing to do.
Why give to Village Healthworks? We give because there's a compelling need. Burundi's extremely poor. These are real people who deserve better. We can help. 2, you see the proof points. You look at the school, you look at the health clinic, it's working. 3rd is it's impactful to have in June of 22, a 150-bed hospital. It's absolutely amazing. What does your gift do for Village Healthworks? You educate kids who have no opportunity otherwise. You help feed children and families. You help the clinic operate on a daily basis, and you help fund the future. It's a privilege to be a small part of Village Healthworks.
I think it's so important to fund Village Healthworks because, to me, it is the future.
The future depends on keeping this dream alive, so that's why it's so important to me.
By supporting Village Healthworks, you're supporting a revolution of health equity.
Your contributions can be magnified many times over to a community that is so well deserves your support.
The people of Burundi deserve Deo's vision, and they deserve that vision to become real.
Please support Village Healthworks so that the people of Burundi can have access to dignified health care.
So that we can finish this 150-bed hospital for women and children. I really believe that it can transform the country.
It is truly an exciting moment at Village Healthworks. Thank you so much from the bottom of my heart for being with us on this long journey. You are making impact in the lives of so many people.
Please support Village Healthworks because our future depends on you.
Thank you so much for being a part of the Village Healthworks community. Together, our friends throughout the world and our friends in the hills surrounding Kigutu are bringing a dignified and healthy life closer for all of us. Please continue to keep Village Healthworks in your thoughts and prayers, and remember that your support will make a tremendous impact. On behalf of Village Healthworks, I wish you all a healthy, happy, and safe holiday season.